everyone. Introduce myself. My name is Solji Halir Muri. I am student from the Indonesian Government University Manado, Faculty of Nursing, class 5 Nursing, 3rd semester. My goal in making this video is to fulfill the final assessment for the English course by Main Silvana Rahama SSM Home, and with the topic I will explain, namely 1. Hospital unit and their function. 2. Doctor who specialist in hospital. 3. Duties of specialist doctor. 5. Hospital units and invocation. A. Polyclinic. The general polyclinic is one of the services that provides medical service in the form of health checks, treatment, and counseling to patients, so that disease transmission and complication do not occur, as well as increasing public knowledge and awareness in the health sector. B. IR. IR stands for emergency unit. The function of the room which is often located at the front of the hospital building is to provide treatment as soon as possible to the patient. The operation hours of the IR are 24 hours and open a whole week. Z. Surgery room. The operation room is a special unit in a hospital. The function as a critical service area that prioritizes aspects of the sterile zoning ERC. D. Clinical laboratory. Laboratory installation is one of the installations in hospital, which is a supporting service that aim to help diagnose a disease so the doctors can treat a disease appropriately, quickly and accurately. Doctor's room. The function and role of the room doctor of our temporary DPJP is given in accordance with the job description that has been set to resolve and handle emergency situations that occur in the inpatient care installation at the hospital. E. Medical warehouse. Pharmacy warehouse is a center for storing and managing pharmaceutical needs in hospital. Yuliasari 2018. The benefits of warehousing in BNPP 2009 are for A. Maintain the quality and quantity of health supplies. B. Organize health supplies. Z. Improved distribution service. If the waiting room. The waiting room for the outpatient installation is a room that functions as a recipient of new visitor to the outpatient installation and also as a conductor for visitors who will leave the outpatient installation. G. Radiology. The main function and purpose of radiological examination is to assist physicians in their efforts to diagnose and treat disease by providing them with timely and reliable information on radiological test result. Hey, rehabilitation. The objective of medical rehabilitation services are overcoming illness condition through a combination of medical intervention, physical therapy, medical technicians, and other allied personnel. Prevent complications to beat traits and or the impact of disease that might lead to disability. Intubation unit. Intubation care is a service for patients who enter the hospital using a bed for the purpose of observation, diagnosis, therapy, medical rehabilitation, and other medical support. Nurse station. Nurse station is ideal for doctors to monitor the patient condition, conduct the counts with other doctors. Meanwhile, this nurse station is used for storing patient drugs, equipment, aids, as well as storing medical records. J. Pantry. The main function of the pantry is to store various cooking utensils and food ingredients. That's why here are many cupboards and cabinets. In its development, the pantry is also used as an area for saving food and drains. Nursing unit. A. Pharmacy. The hospital pharmacy installation as a pharmacy practice place in the hospital is the unit responsible for the implementation of all pharmaceutical work activities, including the management of pharmaceutical supply starting from the selection, planning, placement, stock, preparation, compounding, and service. B. Medical records. The function of the medical records is as a basis for the patient care and treatment, material for evidence in legal cases, material for research and education, the basis for paying health care costs, and for preparing health statistics. C. Sterilization or clean utility. Sterilization is one of the important links for the infection control and plays a role in efforts to suppress the incidence of infection, which in turn can reduce the incidence of infection in hospital, so that patients are safe from the rise of nosocomial infection of eyes infection. For administrative unit. In addition to mothers trailing to the health of patients directly in hospital, of course, there is also an administrative unit that takes care of administration problems related to hospital, including hospital financial management, patient data, staff data, advice, regulation, and so on. Z. General administration role. Hospital administration is the way for you to register and manage cards for outpatient and inpatient care. An administrative division will work to serve patients who come to the administration counter according to the subsection or division of the hospital. Housekeeping and technical housekeeping public areas. A. Clean all floors of the emergency room, doctor room, laboratory, chaser, and medical, all polyclinic, including pediatry and neurology, polyclinic, registration room, medical record room, and downstairs ward. B. Cleaning the front yard, parking lot, front of the emergency room, and next to the mosque. Z. Help prepare oxygen cylinders. D. Throw away garbage. E. Clean the lobby, nurse room, office, hyper treatment rooms, care room, and nutrition unit. D. Cleaning the bakers next to the laundry, next to the kitchen. E. Help prepare oxygen cylinders. F. Clean the lobby and every area of the hospital. G. Throw garbage bag. High. Clean the bathroom, tub, dispenser, can. I. Clean everything, glass frame. E. Checks and clean closets in every room. G. Wiping the trash. Second, specialist doctor in hospital, minimums follow. Internal medicine. 1. Internal medicine specialist. 2. Pediatricians. 3. Neurologists. 4. Obstetrician and gynecologists. 5. Surgical specialist. 6. Dermatologists and gynecologists. 7. INT specialist. 8. Ophthalmologist. 9. Psychiatrists. 10. The ninth. 3 specialist Dr. Doughty. 1. Internal medical specialist. Internal medical specialist atau SPPD, also known as internist, is a doctor who is specialist in diagnosing and treating a number of health problems experienced by elderly patients. Examples are many problems: heart disease, diabetes, hypertension, gastrointestinal disease, respiratory disease, and kidney disease. 2. Pediatricians atau SPA, also known as pediatrician, is a doctor who is specialist in diagnosing and treating patients aged 0 sampai 18 years. Generally, all diseases they occur in children, whether physical problems, behavior to mental health, will be referred to a pediatrician. However, it is possible for pediatricians to also cooperate with other specialists. For, for example, when dealing with psychiatric problems, the pediatrician will work closely with psychiatry, or when the child's condition requires surgery, the pediatrician will work with a pediatric surgeon. 3. Neurologists. A neurologist or neurologist atau ISBN is a doctor whose job is to diagnose, treat patients with disease related to the nervous system, from the brain, spinal cord for the peripheral nervous system. Neuropsychiatrists usually treat stroke patients, nervous system infection, incurable tumors, autoimmune disease that attack the nervous system, seizures, movement disorders, muscle disorders due to neurological disorders, migraines, dementia, and peripheral neuropathy. Obstetrician and gynecologists, according to the title obstetrician and gynecology specialist, HPOG, a specialist expressed in two files, namely express is pregnancy, as childbirth or obstetrics, and express in reproductive health or gynecology. The field of obstetrics serves all things related to pregnancy and childbirth, both normal and problematic. Meanwhile, the field of gynecology serves complaints related to reproductive health, such as menstrual and menopause problems. 5. Surgeon specialists. Surgeon or doctor with specialists all related to surgical procedures. You can consult a surgeon if you have an abnormal lump in a certain area, or a one that does heal. Some cases require a surgeon with special expertise. For example, surgery for cancerous tissue will be performed by a surgical specialist, while surgery one will be performed by an orthopedic specialist. 6. Dermatologists and gynecologists. A dermatologist and venereal specialist, ISPKK, is a doctor who specializes in diagnosing and treating skin and genital health problems, both experienced by men and women. There are many diseases related to the skin and genitals. However, some health problems that are generally treated by dermatologists and genital specialists are skin allergies, fungal infection, herpes, skin cancer, and various sexually transmitted infection. 7. INT specialist. An INT specialist or INT or otolaryngologist is a doctor who specializes in diagnosing, treating people with ear, nose, and throat disorders. Health problems that can be handled by an specialist include sore throat, sleep apnea, sinustic ear infection to tumors in the head and neck. 80. Ophthalmologists. An ophthalmologist or ISBM or ophthalmologist is a doctor who is expert in dealing with eye health problems. In addition to condition eye examination, ophthalmologists can also prescribe medication or glasses and also performs eye surgery. Eye health problems that are usually treated by ophthalmologists include vision problems, eyelid problems, eye irritation, while the tones go away, or aggravated eye disease such as cataracts. 9. Psychiatrists. Psychiatrists are doctors who specialize in mental and behavioral health. Psychiatrists deal with problems related to emotional, psychiatric and behavioral disorders of patients through counseling and medication. Examples of mental health problems they are generally treated by psychiatrists are depression, bipolar disorder, schizophrenia, dementia, autism, education problems, and also sexual problems. 9. The nuns. The nuns are not necessarily specialists. The nuns are doctors who specialize in dealing with dental and oral health problems. A dentist's degree can be obtained without taking a general practitioner education first. There are various dental health problems that are usually treated with the nuns, ranging from bleeding gums, sensitive teeth cavities, to chronic breath problems. Similar to general practitioners, the nuns can also take their own specialist education, including oral surgery specialists, pediatric dentistry specialists, orthodontists, oral disease specialists, and prosthodontic specialists or dentists.
Selamat datang di Universitas Pembangunan Indonesia Manado yang terletak dekat dengan kawasan bisnis Bahu Mall Manado. Tempatnya di Kelurahan Bahu, lingkungan 3 Manado, sangat strategis di pusat kota Manado. Dibangun di atas lahan seluas 2,5 hektar, Universitas Pembangunan Indonesia Manado berdiri megah dengan ruangan 7 lantai, terdiri dari ruangan kelas, ruangan kantor, perpustakaan, laboratorium komputer, laboratorium keperawatan, pengadilan semu, dan laboratorium bahasa, kantin, serta rooftop di lantai atas. Universitas Pembangunan Indonesia Manado memiliki 6 fakultas dengan program studi, yaitu Fakultas Pertanian, Prodi Agribisnis, Fakultas Hukum, Prodi Hukum, Fakultas Teknik, Prodi Teknik Elektro dan Teknik Sipil, Fakultas Ilmu Sosial Ilmu Politik, Prodi Ilmu Politik, Fakultas Sastra, Prodi Sastra Inggris, Fakultas Keperawatan, Prodi Ilmu Keperawatan, dan Profesi Nurse. Didukung oleh sumber daya manusia yang berkompeten dan tersertifikasi, Universitas Pembangunan Indonesia Manado memiliki dosen dan tenaga kependidikan dengan latar belakang S2 dan S3 lulusan dalam dan luar negeri. Proses belajar mengajar dilaksanakan dengan teknologi informasi merujuk perkembangan dunia modern saat ini, dilakukan dengan sistem e-learning dan sistem ujian online atau ULAIN. Hasil Tracer Student Universitas Pembangunan Indonesia Manado dan Fakultas menyebutkan lulusan UNPI sudah tersebar di dalam dan luar negeri. Selamat bergabung putra-putri terbaik bangsa. Kembangkan dirimu, raih cita-citamu setinggi bintang di langit. Kami siap menghasilkan generasi terbaik dan pemimpin di masa depan.